Communication and language are areas of thinking that are often impaired for people living with dementia. Word finding is often a problem that people have early in the disease process. Some people living with dementia may need assistance finding words. Others may become frustrated if people do not give them enough time to find the word they're looking for.
Before we left the house, do you remember to bring the
forms? Yeah.
Yes, the form. I know it's the form. You don't have to cut in.
Okay.
For individuals who have a very large vocabulary, it may be easy for family members to miss the symptoms of word finding. Sometimes people's speech patterns change, and they may begin to speak in more general terms. In the very late stages of the disease process, people may have very little coherent speech. It's important to include the person living with dementia in all conversations. We need to model this for their friends and family members. Just because they have had changes in the way they're communicating with the world does not mean we can assume they can't understand what we're saying. It's important to speak slowly and clearly to give the person living with dementia time to process what we're saying. It's also important to avoid asking multiple questions at the same time and run-on sentences with multiple instructions. As language abilities change and the person is relying less and less on words as a way to communicate, the person living with dementia may begin having more behaviors. All behavior has meaning, so you want to help the family members look at what the person living with dementia may be trying to communicate. Does aggressive behavior really mean that the person is experiencing hunger or pain and he's having trouble communicating that to the people around him? As communication changes, it's important to remember a few communication tips. The person living with dementia may require more time to process what you're saying, so remember to speak slowly and clearly. You want to model this for friends and family members as well. As a clinician, it's important to speak with the person living with dementia regardless of what stage of the disease the person may be in. Oftentimes, if a person is in the later stages of the disease, they may have lost the ability to communicate coherently with language. It's important that you still include them in your conversations and that you attempt to solicit their input. Communicating with people living with mild cognitive impairment typically doesn't involve much communication changes. They're able to follow conversations, they're able to understand language, and they're able to express what they would like to say. They're able to follow complex conversations, and this is an appropriate time to engage them in advanced planning. Do you have any questions about what the doctor told you?
Well, I think this is much to do about absolutely nothing. I simply had a bad day on the day that I was tested, and everybody has a bad day.
Sure.
It's more than that, baby. You've had several bad days lately. So let's listen to what she has to say. It's for our best interest.
Several bad days?
So the doctor's done a number of different tests to determine what's going on in your brain, and he's noticed some changes that you've been having. What we want to do today is come up with a plan to make sure that we can address your needs as your brain changes, and we can address your needs as well.
Thank you very much. We'll get through this like we always do. We're strong.
Oftentimes, family members are frustrated when their person doesn't accept the diagnosis or can't remember that they forget. Oftentimes, family members say they just need to try harder. They just need to accept it. This is something that can be difficult for the person living with dementia. There's actually a clinical term for that called anosognosia. It means that people forget that they forget. And this can be helpful for family members to remember that it's not about how hard they're trying. They just really can't remember that they're forgetting. Judgment is often an area of thinking that's impaired in someone who's living with dementia. Logic is not an effective communication strategy for the patient or the CSE in working with people living with dementia. It's a very tempting strategy because it's one that makes sense to the family members, but it's important for the CSE to remember to not engage in a logical battle with the patient. It's important that you validate the patient's feelings and respond to the emotion behind the request, but you won't logically win an argument with the person.